It's estimated that over 35 million people have died in the 4 decades since the AIDS pandemic began, and that 38 million people around the world are currently living with HIV.
The message of this day is to remind people that HIV is still there, but also the fact that there have been major developments in HIV. Now it's not a death sentence as it used to be many years ago. And now what we want is for people to take care and to be careful. We also commemorate the deaths of many people who died of HIV or AIDS at the time. And we try and remember them by wearing the red ribbon.
Last year, the GHA made the preventative medicine PrEP available at the Well Person Clinic.
People got to know about PrEP. Actually, some people already knew and they were asking for that. They had been asking for it for a long time. They were very happy to start it, and it's been good because since then we've prevented HIV infection. We haven't had any new HIV diagnosis. There was only one, but he was caught when he came to start the PrEP. So I think that people are happy with it, and we think that it's been successful.
We've got approximately about 50 patients, maybe just a bit less than that, on PrEP. And what we do in the Well Person unit is that we review them every about 3 months, so we can do all sorts of STI testings as well. It's really important. Our main message, I think, on World AIDS Day and preventing HIV, apart from PrEP, which is a really good method in preventing HIV, is also condoms is always going to be our #1 preventative method, but not only for HIV, for other STIs. So it's really important to come down to the sexual health clinic in the Well Person unit to get tested for all infections.
As well as prevention, there's also treatment available for people with HIV.
Once a patient is confirmed to have HIV infection, we start the treatment right away. So it's really good because within the first few months, perhaps sometimes even the first month, the patient can get undetectable, and if you have undetectable viral load, that means that you are untransmittable. So you don't give the infection to anyone else. So you can be and do life as if you didn't have the infection, which is really good. And as well, nowadays, the treatment has developed so much that in the past, patients had to take so many pills and they had so many side effects like diarrhea, vomiting, etc. But right now, they don't even have any side effects.
You can find out more about HIV prevention on PrEP at gha.gi or book a confidential and anonymous HIV test on 200 07842.